Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a former C&P examiner, compensation and pension examiner, U.S. Army veteran, and physician assistant. I wanted to come on today and do a video about fibromyalgia and what you can expect in a compensation and pension exam. I've done several videos about what to expect in a C&P exam, and I've got a lot of positive feedback that this has been helpful because a lot of you guys go to C&P exams. So hopefully you will find this one equally as helpful. So let's just jump into it. So what is fibromyalgia? So I'm going to share my screen here with you guys, and we're going to talk about that. Okay. Fibromyalgia, as defined by the American Academy of Family Physicians, right? Fibro is an idiopathic chronic non-articular pain syndrome with generalized tender points. It is a multi-system disease characterized by sleep disturbances, fatigue, headache, morning stiffness, paresthesias, and anxiety. Nearly 2% of the general population in the U.S. suffers from fibro, with females of middle age being at an increased risk. Diagnosis is primarily based on the presence of widespread pain for a period of at least 3 months and the presence of at least 11 tender points among 18 specific anatomic sites. There are certain comorbid conditions that overlap with and also may be confused with fibro. There has been improved recognition and understanding of the condition. Although there are no guidelines for treatment, there is evidence that a multidimensional approach with patient education, cognitive behavioral therapy, exercise, physical therapy, and pharmacologic therapy may be effective. Okay. So I have another video about fibromyalgia. You guys might find it helpful. That talks more specifically about the disorder and VA disability itself. But just to touch on the highlights, where do we see a lot of people service connected for fibromyalgia and in what circumstances? So from a primary standpoint or direct, if you were diagnosed with the disorder on active duty, we can see that just because you got diagnosed while you were on active duty during a period of active duty, right? A lot of Gulf War veterans, a lot of veterans that were 1991 to present, and there's very specific areas that you can look at on va.gov. There's a comprehensive list. Fibromyalgia is often linked to chronic multi-system illnesses that are seen in veterans that serve in different areas of operation. And then on a secondary basis, related to other disorders. So either from a causative or aggravational standpoint, we have seen, mental health conditions can worsen or exacerbate fibromyalgia. I've seen that related to PTSD on numerous occasions. Okay. So, or depression or other conditions. That is, of course, not in every case. And there are other conditions that it can be linked to, but those are just some of the ones that I have seen. So what is going to happen in a C&P exam? So this is a really great question, and it's something that you guys can try to expect some consistency on, at least in the questions that you're going to get asked. So if you file a claim for fibromyalgia with either on your own or with the assistance of a VSO or an accredited claims agent or an attorney, I'm not none of those things, by the way. I'm just a medical expert that reviews files, forensically looks at files, and assists with these types of reports. But if you file a claim for fibromyalgia, generally speaking, you're going to get a packet in the mail that's going to tell you when your C&P exam is going to be. If you get scheduled a C&P exam, it's going to tell you who the doctor is going to be, what their specialty is, how long they've been a C&P examiner, where it's at, the time, all that kind of stuff. A lot of veterans will go look up that doctor and kind of look at their reviews, see what their history is, their background. It doesn't mean you're going to have a rheumatologist, which is one of the specialties that treat fibromyalgia. Also, family practice can treat fibromyalgia. A wide range of healthcare providers can treat fibromyalgia, really, but you may very well be seeing a nurse practitioner, a physician assistant. You could even be seeing an OBGYN, right? There's a wide variety of C&P examiners that you could be seen by that qualify to do this type of exam. Okay. So you're going to show up to your examination, and they're essentially going to run down what's called a disability benefit questionnaire. That is a list, and I'm going to pull that up here in a second. You can find this on va.gov. You can pull it up yourself, and you can take a look at it in advance so you can kind of know the questions they're going to ask. And this is a form that was developed so that the questions can be asked that the raters know will line up with what's in the 38 Code of Federal Regulation that aligns with the specific rating criteria, which we will also go over later. Okay. So let me pull up the fibromyalgia DBQ for you guys so you can see what it looks like, and we can go over it together. Okay. Okay. So here it is. So this is the fibromyalgia DBQ. Okay. You can find this on va.gov. That's where I'm at. So you can see right up here, benefits.va.gov. It's right up there. You guys can go and pull this off. And this is what they're going to go over when you're at your C&P exam. Your C&P examiner is going to have this document. They may or may not have it in the room with you, but they're going to fill it out when you're done. So it's going to have your name, all your information. This is some information that is about the examiner. Okay. You can also have your private treating physician fill one of these out if you'd like, right? You can print this off and ask your private doctor to fill it out. And it's going to ask them these specific questions, how they know you, etc. What records did they review? Okay. It's going to ask what hand dominance are you? Are you right-handed, left-handed, ambidextrous? What is your diagnosis? Do you have a diagnosis of fibromyalgia? Okay. If yes, check all that apply. So you can see fibromyalgia, the ICD code, that's a specific code that is assigned to fibromyalgia in the civilian healthcare system. It's a pretty standard code. The date of diagnosis, other diagnosis that may pertain. If there's other diagnosis, they want them to list them here. And then it's going to ask to describe the history. So they may ask you like, how long, tell me about the onset of your fibromyalgia. When did you start noticing those symptoms? Tell me about it, right? They're going to take a quick history and they should fill that in here. You may want to have your ideas and your thoughts together so you can not be surprised. Like, hey, I know that this started in 2004 while I was on deployment or whatever, right? Is continuous medication required for control of the symptoms? Yes or no? So if you're taking a medication, whether that's Cymbalta or Lyrica or some other kind of medication that your doctor has prescribed, you're going to talk to them about that and let them know. Are you undergoing treatment for this condition? Yes or no? You may say, yes, I'm seeing a rheumatologist. Yes, I'm seeing my primary care doctor. They're managing the condition for me. No, I've never been diagnosed before. I just think I have it. Right? Whatever the answer is. Are your symptoms refractory to therapy? This is kind of a subjective question, right? So this is kind of like, I guess you can tell them, hey, I take all this medication. I'm still super symptomatic. It's horrible, whatever. And they may say, yeah, your symptoms are still present and not doing very well despite taking medication, right? Findings, signs, and symptoms. Does the veteran have any findings, signs, or symptoms attributable to fibro? If yes, check all that apply. Widespread musculoskeletal pain. Note, for VA purposes, widespread musculoskeletal pain means the pain occurs in both sides of the body, both above and below the waist, and affecting both axial skeleton, meaning the cervical area, the chest, the thoracic spine, the extremities. So widespread, kind of like all over the place. Are you having stiffness, muscle weakness? And then describe. Are you having fatigue, sleep disturbances, paresthesias, headache, depression, anxiety, irritable bowel symptoms, Raynaud's-like symptoms, which is another thing that we could, cold. It's basically a loss of sensation and some coldness in the fingertips, things like that. Other. See, these are some of those things we talked about on that American Academy of Family Practice, some of those symptoms, okay? Frequency of symptoms, episodic, present more than 1/3 of the time, constant or nearly constant, often precipitated by environmental or emotional distress, okay? Now, here's the exam portion, okay? Now, they're going to go over all those points. Remember, we talked about all those 18 points or whatever? So they're going to go over all those points, right? And then they're going to describe left or right side or both. Do you have it in your neck, in tenderness points or trigger points in your neck, your second rib, the back of your head, your trapezius muscle, your supraspinatus muscle, your lateral epicondyle in your elbow, your butt muscle, right? Your gluteal muscle. And it describes it, right? The upper outer quadrant of the buttocks, the greater trochanter, right? That's over your hip, your knee, okay? They got to check all these little blocks. Then any other pertinent physical findings, like a catch-all block for them to describe. Any imaging studies or tests that have been done, like if you've had any labs or anything like that, they're going to write it in here. Functional impact. Does it impact you from an occupational standpoint, like lifting, walking, sitting? Describe. Do you use any assistive devices like a wheelchair, braces, crutches, etc.? Remarks. Okay. And then they're going to sign it. Right. Okay. Let me stop sharing. All right. So that's what they're going to go over. Right. That's it. So if you can get that and turn it in yourself, you may be able to skip the C&P exam. You not necessarily, but they always reserve the right to schedule you a C&P exam. But if your treating doctor, if you print that sucker off and you ask your treating doctor to fill that out, turn it in, you might not have to go to one. But that's the information that they need to give you the ratings, right? So I am not a rater or an examiner. I'm sorry, I'm not a rater or a VSO or any of those kinds of things. But I know you guys like to talk about ratings, so I want to go over those really quick. So ratings are always subject to change, okay? But for right now, fibromyalgia is rated. You can look this up. It's in the 38 Code of Federal Regulation, and it's rated under Diagnostic Code 5025. And it's at 10%, it requires continuous medication for control. 20% is episodic with exacerbations often precipitated by environmental or emotional stress or overexertion, and that are present more than 1/3 of the time. Remember, that is a block that's checked on that DBQ, right? See how it's starting to marry up? You guys see how this stuff works? 40% that are constant or nearly so and refractory to therapy, okay? So those things that are checked by that C&P examiner on that block or by your treating doctor are things that rater is going to look at to say, okay, here they fall into this category or this category or this category, right? It's all a system, okay? So I hope this was helpful, and you guys check out my other fibromyalgia video. I'm going to try to post a link up here for you guys to watch it. And drop some comments. Let me know if there's anything else you guys would like to hear about, and I'll talk to you guys soon. Thanks.